Hello friends, welcome to Creative Medicine. In this lecture, we will learn about post-traumatic stress disorder. Is differentiated from other disorders by the presence of. In post-traumatic stress disorders, there will be nightmares about the event, autonomic arousal and anxiety will be there, and recall of events and avoidance of similar experiences will be there. Depression is not there. Next. Here, even depression is also present in post-traumatic stress disorder. But if you see the question is about the differentiating features of post-traumatic stress disorder from other disorders. Post-traumatic stress disorder is differentiated from other disorders by the presence of. So, the main important feature of post-traumatic stress disorder is recall of events and avoidance of experiences is actually typical of post-traumatic stress disorder. All the others, like nightmares about the event, autonomic arousal and anxiety, depression, are also present in post-traumatic stress disorder, and these are also present in other disorders also. But mainly recall of the event and avoidance of similar experiences is the typical for post-traumatic stress disorder. Thank you, and thank you for watching.